Hi, everybody. So, my topic that I was assigned was mitral stenosis. So, as I talk about it, I'm going to put some pictures right here on the screen so you can visualize while I speak. So, mitral stenosis is essentially an obstruction of blood flow from the left atrium to the left ventricle. And as far as etiology, it is most often caused by rheumatic endocarditis, which progressively thickens the mitral valve leaflets and the chordae tendineae, causing the leaflets to eventually fuse together. And later on down the road, the mitral valve orifice narrows and progressively obstructs the blood flow into the ventricle. One of the most common symptoms of mitral stenosis is dyspnea on exertion, as seen in this woman here. It is a result of pulmonary venous hypertension. Sometimes symptoms will develop after the valve opening is reduced by 1/3 to 1/2 its usual size. So this is usually when you start to see symptoms occurring, which means it can occur in the beginning without a lot of symptoms. Patients also may experience fatigue and decreased exercise tolerance as a result of low cardiac output. So an enlarged left atrium, as seen here, may create pressure on the bronchial tree, which could result in the dry cough or the wheezing. Patients can also have hemoptysis, or they could experience palpitations, orthopnea, paroxysmal nocturnal dyspnea, and repeated respiratory infections because of mitral valve stenosis. And as a result of increased blood volume and pressure, the atrium dilates and hypertrophies, which causes the heart to become electrically unstable. And then this leads to patients experiencing atrial dysrhythmias. So the biggest part of prevention for mitral stenosis is to minimize the risk of and treatment for bacterial infections, which pretty much just refers to the rheumatic endocarditis. So with that being said, prevention of acute rheumatic fever depends on the antibiotic treatment for group A streptococcal infections, since that is what drives the rheumatic endocarditis. So antibiotic prophylaxis for recurrent rheumatic fever with rheumatic carditis could require up to 10 or more years of antibiotic coverage. And some of these treatments of antibiotics, just some examples, are penicillin G IM every 4 weeks, penicillin V orally twice a day, sulfadiazine orally daily, or erythromycin orally twice daily. As far as treatment for it, patients with mitral stenosis can benefit from anticoagulant therapy to decrease the risk of developing atrial thrombus and could require treatment for angina. So if AFib develops, cardioversion is typically attempted first to restore normal sinus rhythm, and if this is unsuccessful, then the ventricular rate is usually controlled with beta blockers, DIG, calcium channel blockers, and furthermore, the patients usually require anticoagulation therapy for thromboembolism prevention. Patients with mitral stenosis are also advised to avoid strenuous activities, competitive sports, and pregnancy because all of these things increase your heart rate, which is something you want to avoid. And lastly, surgical intervention, such as valvuloplasty, can occur as treatment, specifically percutaneous transluminal valvuloplasty or valve replacement to help treat this disease.